Okay, so let's go ahead and get started. So we are recording this for those who could not be available for the live presentation this evening. And again, if you are watching this live this evening on October 3rd at 5 o'clock, you're going to be redirected to complete the quiz at the end of the presentation. If you are watching the recording on demand at another time and date, please scroll below this video. You will see a link to the quiz and the handout. It will not be emailed to you. So scroll below the video, you'll see the instructions, review the instructions, and you will see a link to take the quiz. So thank you everyone for being here and for watching this video this evening, Nutrition, a Bilateral Relationship with Oral Health. Normally, I am on, my video is on, my camera is on, but I am on starting into week number 3 of recovering from COVID, believe it or not. So I feel like I'm on the mend, but not quite camera ready. I should be maybe by tomorrow. Hopefully you all will skirt the latest COVID variant and not have to go through this ordeal. So I do thank you all for being here this evening. Objectives, these are the learning objectives in your handout. We know that there is a bidirectional association with oral health and nutrition. We know that oral infectious diseases, acute, chronic, and terminal systemic diseases with oral manifestations impact functional ability to eat, as well as the reverse, diet and nutritional status. Likewise, when our nutrition and diet are challenged, they can affect the development and the integrity of the oral cavity, as well as progression of oral diseases. We also know that scientific and epidemiological data demonstrates a lifelong synergy between nutrition and the integrity of the oral cavity in health and disease. And the Institute of Medicine's Improving Access to Oral Health Care for the Vulnerable and Underserved highlighted the importance of education training of health professionals to integrate oral health information with diet and lifestyle counseling. And we certainly know that dietary factors exist that influence our dental caries risk, right? What are those? Of course, sugar-sweetened beverages, sticky foods, retentive, dehydrated foods such as raisins, slowly dissolving candies, sugary, starchy snacks, simple sugars like sucrose, honey, molasses. And then we also know there are dietary factors that are associated with decreased risk for caries. Sugar-free chewing gum, mints, candies, the xylitol, the polyols, fresh fruits and vegetables, high-quality proteins, whole grains. And then we know there are eating patterns that are associated with increased risk for caries, frequent and prolonged intake of foods rich in simple sugars, eating sticky retentive foods alone, as well as sipping sugar-sweetened beverages for prolonged periods. Now, eating patterns that are associated with decreased risk for dental caries, spacing the frequency of food intake and beverage intake at least 2 hours apart, selecting fresh, whole, unprocessed foods, which stimulate salivary output and buffer the acids, and sugarless gum. Chew sugarless gum or use mints for a brief period immediately after a meal or snack. But we also know dietary factors may modulate immunologic and structural markers of periodontal disease. One is protein. So the impact of inadequate intake of protein can lead to compromised or impaired response to infection, wound healing of the oral soft tissue, compromised antibacterial properties of the saliva, so it actually can create a form of xerostomia. Dietary factors, the fatty acids, vitamin A, C, E, copper, iron, zinc, and non-nutrient antioxidants. When we see inadequate intake, it may lead to depressed anti-inflammatory and immune response of the oral soft tissue. We don't respond well to infection or surgeries, for instance. And vitamins D and K, calcium and boron, Inadequate levels may lead to inadequate jawbone density and the strength to anchor the tooth structure. So it may affect the periodontium. I want to remind you all to use Chrome browser. Chrome browser is what this platform runs on. If you're using Safari, it may affect your audio video. Okay, so the sippy cup, this was the bane of my existence as a public health dentist. And I treated primarily infants and children. And oftentimes these children would walk in with just a multitude of challenges, right? Parents not clear on the concept, parents who may have dental disease that was untreated, they're passing saliva and therefore bacteria to the infants, and then they're handing the infants these sippy cups of more substrate. So, of course, ECC was a big concern. But we also know malnutrition can also impact oral health. And as we said, we'll see that protein deficiency in the diet can lead to a form of xerostomia that can affect the quality and quantity of saliva and the protective factors of saliva. And of course, the various other forms of beverages, the Sunny Delight, which was also the bane of my existence, and so forth. So sugar-laden sweets. But older adults as well have their own challenges. And this, of course, is an older adult. Great smile, seems to be very happy, healthy. Chewing an apple, always a good sign. And for our older adults, meal times are particularly important, not just for their nutritional status, but for their mental health. Imagine what COVID did, the pandemic, over the last few years. And in the last few years of my clinical career, I oversaw a very large geriatric program here in the Phoenix area. It was a mobile program, and we went into various facilities to treat homebound patients and those living in place or living in various communities, long-term care, various levels of care. And in these residences, if you will, one thing that is paid particular attention is, are these residents eating at their table with their table mates? Because this is a very large form of socialization for these older adults. And so it's very important. These facilities want to make sure that they are socializing. It's important to their mental health and their well-being. So we have two older adults here. They're enjoying protein, vegetables, and so forth. And this is what you want to see. But unfortunately for me in my practice, this was often what I saw far too many times than I would have liked to. And this is our patient who is what I used to call in the tapioca line, right? Patient here looks to be probably edentulous or partially edentulous, and they're eating Jell-O and they're isolating. They're in their room. They cannot sit at a table with their table mates and eat these foods because they can't chew them. They may be in pain. They may be suffering from xerostomia. And ultimately, this is going to impact their nutritional status. And it's a double-edged sword because once their nutritional status is impacted, that is going to affect the integrity of the oral cavity. And I've got some photos here for you too as well. So this was a photo that was kindly offered by Mobile Dentistry here of Arizona. And we co-authored an interview with National Public Radio a couple of years ago where we shared cases and so forth and the challenges of providing care to older adults in these various facilities. And this was a patient from a skilled nursing facility here in Prescott, Arizona. And you can see what is a case of Xerostomia gone wild. Nobody recognized this as an issue. You can see long-standing root tips where the tissue has grown in. They, of course, look like they lost an upper left permanent bridge. They lost the anchors to their partial dentures and so forth. And this is a huge issue. And when you have a patient who has suffered from long-standing xerostomia and they're in this condition, they can be quite malnourished. And when you jump in and extract root tips, oftentimes you're going to be challenged with delayed healing and post-operative infection and so forth. So again, these meal times are super important for this age group. They love to sit together. They love to converse. They love to converse around their meals. So when you are challenged, your oral health is challenged, and you can't be a part of this group, it's sad and depressing. So I believe we have a duty, an ethical duty, to make sure that we're able to reach out and safely treat this patient population, which is now transitioning into the boomer population. Here's another case of xerostomia. This was a facility in the Surprise, which is the West Valley region. And another one. So again, these patients become quite malnourished, and they're not going to be sitting with their table mates. They're going to be at the tapioca line. So ultimately, for our older adults, nutritional status is super important, and we want to see that happy face on the right-hand side and a nice smile. Any questions or comments? And again, for those of you that may have joined the live presentation a little late, please look in the chat area. We do have the link to the handout. You'll need that if you also check your email. It was sent to you about 30 minutes ago. For those of you that are watching the recording from our website a little later, just scroll down below the video, tap on the instructions. You're going to see the link to the handout as well as the quiz. Okay, so we define nutrition as materials and food necessary to support life, and it may be defined as the science of food and its relationship to health. We'll be emphasizing oral health this evening. It's the science that is concerned primarily with the part played by nutrients in body growth, development, and maintenance. And again, the World Health Organization has also defined nutrition as the science of food, its relationship to health, and malnutrition is defined as the cellular imbalance between the supply of the nutrients and the energy in the body's demand for them to ensure growth, maintenance, and specific functions. Now, many of you may wonder, why on earth do I have a slide of Audrey Hepburn here? Well, Audrey Hepburn happens to be one of my favorite actresses, but many of you may not realize that Audrey Hepburn, as a child, nearly starved to death during World War II. She had dreams of becoming a ballerina, and her family fled to Holland, now the Netherlands, right? And during that time, from age 9 to 16, the Nazi invasion of Holland, called the Hunger Winter, was the famine that lasted in the region until the area was liberated in 1945. So from years 9 to 16, she almost starved to death, and her family survived on eating tulip bulbs that they would dig up out of the ground to make flour and therefore bread. It's believed that as many as 22,000 people lost their lives during that time. Her dream of becoming a ballerina was erased, right? Because of severe health issues that she developed from being so malnourished, bone issues, and so forth. Now, we know she went on to become a very famous actress, but this just highlights how important diet and nutrition play over various phases of our lives, right? So diet and nutrition play a key role in tooth development, gingival and oral tissue integrity, bone strength, and the prevention and management of diseases of the oral cavity. And we know that teeth are made from a protein matrix that's mineralized, but it requires collagen, which requires vitamin C, calcium and phosphorus that requires vitamins D and A. And the nutrient, the definition is a substance that an organism must obtain from its surroundings for growth and the sustenance of life. And classes of nutrients that you're familiar with are carbohydrates, fats, proteins, vitamins, water, minerals, and oxygen. When we talk about carbohydrates, we're talking about a form of energy, and the main building blocks of carbohydrates are sugars, and sugars are made up of carbon, hydrogen, and oxygen. And they're commonly found in pasta, bread, fruits, vegetables, and whole grains. So we have simple carbohydrates, and we have complex carbohydrates. Fats also provide the body with energy. They help to build cell membranes. We require fats in our diet, help regulate hormonal body processes, help to transport vitamins, as well as insulation. Proteins also provide us with energy found in the muscle, bones, skin, hairs, almost all body tissues, and the building blocks of proteins are amino acids. The human body makes non-essential amino acids, but our essential amino acids must come from our diet. And animal proteins tend to deliver all of the essential amino acids that we need. And we can note that grains, nuts, seeds, and beans can or may lack the full amino acid chain. Okay, so breaking down proteins even further. Proteins are required to help build, maintain, and repair body tissues, assist in the transportation of fats, vitamins, and minerals, as well as enzymes, hormones, and antibodies. So if you are severely malnourished, as some of the photos we saw earlier, your diet may be deficient in protein. And again, when we are going to go in and remove root tips perhaps, and maybe in some of these patients place implants, it's really important that we help to upgrade the nutritional status of our patients so that we can expect healing and repair and hopefully less chance of infection. Okay, so we have a breakdown here for you of vitamins, and there are so many details about vitamins. What I want you to understand for this evening is the importance of the vitamin B complex, which we'll describe and its effect on oral health. So let's start there. We're going to be talking about B1 thiamine, B2 riboflavin, B3 niacin, B5 pantothenic acid, B6 pyridoxine, and B12 cobalamin. We'll also be talking about folate, vitamin C, biotin, and then our fat-soluble vitamins, A, D, E, and K. Vitamins are key to normal body processes. The body is nothing more than multiple chemical reactions that require various vitamins and so forth and energy to conduct these processes, if you will. And vitamins are defined as non-caloric organic nutrients that our body does not make on its own. They are necessary for these biochemical reactions in our body, and there are required amounts in the diet to perform these biological functions, specific biological functions for the normal maintenance of optimum growth and health of the organism. So the body cannot create vitamin molecules. Exception is vitamin D. So the vitamins must come from the food or supplements. We need at least 13 different vitamins. So common vitamins, again, vitamin D, B complex, and vitamin C. There are two classes of vitamins, water-soluble and fat-soluble. The water-soluble vitamins are readily excreted from the body, usually through the urine. And fat soluble may be stored in the lipid areas of the body. And so water soluble vitamins, because they are readily excreted, not for the most part, won't rise to toxic levels. But in some cases, if somebody takes too much of a vitamin, they can have toxic levels of even water soluble vitamins. The fat soluble vitamins, because they are stored in the lipid areas, are of concern, because if somebody is taking too much vitamin, or they're getting too much of a certain particular vitamin in their diet, they can unfortunately reach toxic levels. All right, so the water soluble vitamins would be vitamin C and the B complex, and then the fat soluble vitamins, A, D, E, and K. So water soluble vitamins are absorbed directly into the blood, whereas fat soluble are absorbed with the lipids through the lymphatic system. Our water soluble vitamins circulate freely in the water-filled spaces of the body, where the fat soluble vitamins again are stored in fat, excreted through urine in terms of water soluble. Fat soluble, as we said, not as easily excreted, so they're stored in the body, and toxicity is possible from supplements for both water and fat soluble vitamins. However, it's much more common for fat soluble vitamins to cause toxic levels if someone is not taking the appropriate dose, or they may be absorbing too much. All right, so vitamin A is important for vision, cell division, differentiation, healthy skin, to regulate the immune system, reproduction, and bone growth. Maintains the surface of the lining of the eye and the pigment. And we get vitamin A from various animal sources and plant sources. Signs of vitamin A deficiency may be night blindness, decreased resistance to infection, extremely dry skin, hair, or nails, corneal ulceration, and an oral health, impaired tooth formation, and enamel hypoplasia. And these are the signs of vitamin A toxicity. Now, retinoic acid, or Accutane, are very, very high levels of vitamin A. That is why someone who is taking Accutane will have lab work done periodically. Women of childbearing age should not consume more than 8,000 IUs per day because of severe birth defect. The skin can actually take on a yellow or orange glow. And most cases of vitamin A overdose occur from supplements, but can also occur from the diet. Vitamin D, different from all the other vitamins because the human body can synthesize it with the aid of sunlight. And we can not only manufacture vitamin D, which is really the best way to get our vitamin D, is to get a healthy dose of sun, but we have to be concerned about skin cancer, of course, but also from our diet: fleshy, oily fish, egg yolks, liver, etc. And that is the absorption and formation and production of vitamin D from the skin. Okay, vitamin D's function in bone formation and maintenance: assists the absorption of dietary calcium, helps to make calcium and phosphorus available in the blood, and stimulates the maturation of cells, heart, brain, immune system, and so forth. Vitamin D deficiency in children is called rickets disease. In adults, it's called osteomalacia, and that loss of calcium from the bone and deposition in the soft tissues can lead to kidney stones. Of course, deficiency can also lead to loss of appetite, psychological depression, nausea, and vomiting. But what about vitamin D and oral health? Vitamin D has been shown to regulate musculoskeletal health. It mediates calcium absorption and mineral homeostasis. And evidence demonstrates that vitamin D deficiency can place subjects at risk, not for just low mineral bone density and osteoporosis and osteopenia, but also infectious and chronic inflammatory diseases. Studies have shown an association between alveolar bone density, osteoporosis, tooth loss, and suggest that low bone mass may be a risk factor for periodontal disease. And there have been several recent reports that demonstrate a significant association between periodontal health and the intake of vitamin D. And an emerging hypothesis is that vitamin D may also be beneficial for oral health, not only because of its direct effect on bone metabolism, but also it acts as an anti-inflammatory agent. So it can stimulate the production of antimicrobial peptides. Vitamin E protects cell membranes and other fat-soluble parts of the body from oxidation. It may reduce the risk of heart disease. It may discourage development of some types of cancer. It may promote normal growth and development, normal red blood cell formation. It can act as an anti-blood clotting agent. Also been known to aid in the process of wound healing. Now, vitamin E deficiency is very rare. Deficiencies often occur due to decreased absorption of fats in liver disease or low-fat diets. Premature babies may have what is called fragile red blood cells, hemolysis, and that can lead to loss of muscle coordination, vision, and immune functions. Vitamin E toxicity increases the effects of anticoagulants. So patients on anticoagulants, Coumadin and warfarin, have to be careful about the levels of vitamin E they consume. Okay, vitamin K, required for the production of blood clotting factors, essential for coagulation. We find it in the cruciferous vegetables, for instance, also present in egg yolk, meat, liver, cheese, dairy products. Administration of large doses of vitamin K can produce hemolytic anemia and jaundice. And vitamin C. So vitamin C has been shown to be toxic at some levels to viruses, bacteria, some malignant tumor cells. Protects the body from free radicals, helps in the formation of collagen, aids in wound healing, helps to keep the gingiva healthy, aids the body in absorbing iron from plant sources, helps the body to fight infections, aids in the prevention of heart disease, and is an antioxidant. It's water soluble. If you're familiar with Linus Pauling, and you probably are, Linus Pauling really took a reputational blow for the research he did on vitamin C. And his son was my biology advisor at Cal many, many years ago. And now some of Linus Pauling's research has come full circle. They've taken another look at some aspects of his research and vitamin C. Vitamin C deficiency on the extreme is called scurvy. So scurvy occurred because people that traveled on these lengthy cruising or lengthy ships from, let's say, Europe to the US when it took, months and months to get here, did not have access to fruits and vegetables, so forth, fresh foods that contain vitamin C, and they would develop scurvy. So bruising easily, bleeding gums, tendency for the bones to fracture, weight loss, fatigue, joint pain, resistance to colds and infections, and of course, slow healing of wounds and fractured bones. It's thought that harmful effects can occur at larger doses, diarrhea and gastrointestinal discomfort, rebound scurvy, and our patients should be cautioned about using chewable vitamin C tablets because of acidic erosion. Okay, the B1s. B1 thiamine here is the anti-beriberi vitamin. It's water soluble, and dietary sources can be legumes, nuts, pork, fish liver, whole grains, enriched cereals. Produces energy from carbohydrates, important for proper nerve function, stabilizing the appetite and promoting growth and good muscle tone, ATP production. Deficiency, again, is called beriberi, often seen in populations that eat exclusively polished rice. Also loss of appetite, fatigue, weakness, loss of weight, insomnia, depression. B2 is riboflavin, important for energy production, carbohydrate, fat, protein metabolism, the formation of antibodies, red blood cells, for the maintenance of vision, skin, nails, and hair. And sources would be dairy, eggs, and meats, as well as enriched grains and leafy green vegetables, small amounts. Important to know that B2 riboflavin deficiency, called riboflavinosis, has been implicated in some of the angular chylosis we may be seeing in our patients: glossitis, cracks and sores in the mouth, itching and burning eyes, dermatitis, and digestive disturbances. B3 niacin, or known as nicotinic acid, also known as the anti-pellagra preventive factor, important also for the maintenance of the skin and the tongue. So you're going to see some overlap in these B vitamins relative to oral health. Improve circulation, energy production, maintenance of the nervous system, and health of the gastrointestinal tract. And it's important to note that the precursor of NAD and NAD phosphate, which is vitamin B3, plays a critical role in the essential oxidative and reductive metabolic reactions and DNA repair. So again, important for healing. Pellagra is a disease that is rare in Western societies, and it's known as the 3Ds: dermatitis, dementia, diarrhea, and you can add depression, which would be 4Ds. And this is what pellagra would look like in the skin. So it's a deficiency in B3. And once the patient is given sufficient levels of B3 and the pellagra resolves, their skin will go back to normal. But B3 in terms of oral health, we need to be concerned about because it is, again, correlated to atrophic glossitis. So looking at this photo, would you say the patient had xerostomia, or would you say this patient is experiencing a B3 or some sort of nutritional deficiency? Go ahead and just type yes or no or whatever you think into the chat area. So we have both. We have yes, B3, vitamin, yes, okay. Nutritional, B3 or yeast, we have no. Okay, so we've got some great answers here. Thank you all. Angular chylitis and atrophic tongue. So I will tell you, oftentimes in the patients that I've seen, it's all of the above. And sometimes it's hard to tell if it was the chicken or the egg first. If they were on long-standing medications that caused xerostomia, the patient may just be malnourished, and that led to a nutritional deficiency, which caused what we're seeing today. So it could be both. We have to do a really deep dive and find out what their nutritional status may be. I can tell you myself, last year I had a C. difficile infection for almost a year. I became very, very malnourished because I had colitis. And prior to that, I was very proud of myself for being very healthy. But my tongue, after about 2 months of C. diff, looked like this. Because, and it started off sort of cracked and fissured. I developed xerostomia from all the medications I was taking. I was on a very restricted clear liquid diet where it's very difficult to get the nutrients that you need. And I quickly saw that this was also a nutritional issue as well, which the story, of course, is anecdotal, but you'll see it in your patients. So again, no harm, no foul in treating the xerostomia. They're probably going to describe burning mouth as well, which is consequential to what they're describing. So we have to upgrade their nutritional status and address any xerostomia. If they're malnourished, they may be experiencing xerostomia because they're not getting enough protein in their diet, or they're on medications, or all the above. Okay, B3. These are conditions that are associated with niacin deficiency. Chronic alcoholism can be one. Malabsorption, so from colitis, etc. carcinoid syndrome, and etc. Okay, B6 peroxidine is important for the production of red blood cells, immunity, nervous system functions, maintaining the balance of electrolytes in the body. And a deficiency can lead to nervousness, insomnia, loss of muscle control, muscle weakness, arm and leg cramps, water retention, skin lesions. And B12 is cobalamin, right? So required for the proper nerve function, production of red blood cells as well, metabolizing fats and proteins, and DNA reproduction. And then B12 deficiency can lead to iron deficiency anemia, atrophic glossitis as well. So you see what I'm saying about the B complex. There are overlap in terms of oral health, nerve damage, and hypersensitive skin. Okay, let's talk now about minerals. So minerals are defined as inorganic substances that make up the substances of your body. Minerals build your bones, skin, tissues, teeth, and so forth. They're necessary for reactions to occur in the body. There are 14 or more essential minerals that's necessary for health. And we have the whole breakdown here for you: calcium, iron, magnesium, sodium, potassium, as well as the trace minerals: zinc, copper, iodine, selenium, and of course, fluorine. Now, when we talk about malnutrition, which I want to have a discussion here, it's defined as a multifactorial disease. It can have an early onset during the intrauterine life or childhood, or it can occur, again, as we said, during an individual's lifetime as a result of poor nutrition. That can be from disease, infection, or lack of resources. Malnutrition appears to have multiple effects on the oral tissue and the subsequent oral disease development. It affects the development of the oral cavity and its progression of the oral diseases through an altered tissue homeostasis and a reduced resistance to the microbial biofilms and a reduced tissue repair capacity. Let's talk about deficiencies of vitamin A, D, and protein. So deficiencies of vitamin D, A, and protein energy malnutrition, which is caused by a deficiency of protein intake, have been associated with enamel hypoplasia. And protein energy malnutrition and vitamin A deficiency are also associated with a form of xerostomia caused by salivary gland atrophy. And this subsequently reduces the defense of the oral cavity against infection and its ability to buffer the acids. In this study, it was suggested that moderate malnutrition, principally a lack of protein and other micronutrients such as vitamins, zinc, and iron, limits the protective effect of saliva in the oral cavity by manipulating its composition and amount. And when you're manipulating the composition and amount of saliva, that is called xerostomia. Now, the vitamin B deficiencies also affect the oral structures, and we know that vitamin B deficiency can lead to burning mouth, angular chylosis, cracked and fissured tongue and lips, sore throat. And this is a common oral effect of the vitamin B complex. So oftentimes, your patient, especially when they're malnourished, the primary care physician having a discussion with you when you point out that you're going to need to provide some surgical care for this patient, you're concerned about their healing and their long-term possible malnourishment, and you describe the importance of the B vitamins, they will agree with you and put the patient on a B complex. Rather than test them for every individual B vitamin, one can assume that there's going to be some overlap here, and so they will order a B complex. B12, the effects of iron deficiency are similar to those of the vitamin B deficiency. The body requires iron, B12, and folic acid to produce healthy red blood cells within the bone marrow, and a deficiency of vitamin B12 or folic acid can result in immature red blood cells in a condition that is called pernicious anemia. We know that vitamin B2, riboflavin, is needed to break down fat, ketone bodies, carbohydrates, and proteins. And a riboflavinosis can manifest as cracked lips, tongue inflammation, dryness, or burning of the oral cavity. Now, vitamin C plays an integral role in repairing and healing the connective tissue, along with its antioxidant properties. So deficiency, as we know, is called scurvy. That is on the extreme end, and it is characterized by defective collagen formation due to disturbances in the collagen synthesis. And the oral manifestations of scurvy include bleeding gums and gingivitis. And protein, energy, malnutrition, this was a study conducted on children, found that moderate to severe PEM had a reduced salivary secretion rate, a reduced buffering capacity, lower calcium levels, a lower protein secretion and stimulated saliva, and reduced agglutinating defense factors in unstimulated saliva. So those factors, again, were not able to disrupt the aggregation of mutans streptococci, for instance. So PEM can be correlated with the host factors that are associated with the development of caries and tooth defects and the salivary system. So here's a graphic for you on the effects of nutrient deficiencies on tooth development. We just spoke about protein and calorie malnutrition. We may see delayed tooth eruption, decreased tooth size. We spoke about salivary gland dysfunction, decreased enamel solubility, vitamin A deficiency, tooth morphogenesis dysfunction, increased enamel hypoplasia, to name a few. Vitamin D, calcium phosphorus deficiency. We may see hypomineralization, hypoplastic defects, delayed eruption patterns, ascorbic acid, vitamin C. We may see dental pulpal alterations, aberrant dentin, to name a few. Of course, iodine, delayed tooth eruption, altered growth patterns, some question around malocclusion, and decreased or deficiency in iron, slow growth, and salivary gland dysfunction. Some of the nutritional deficiencies and impact on oral health: stomatitis correlated to niacin, folic acid, and vitamin B12 deficiencies; glossitis, the B complex, niacin, folic acid, B6, B12, xerostomia, vitamins A and B12. Also, we mentioned protein deficiency. Chylosis, iron and B vitamins; gingival bleeding, vitamins C and K; glossodynia, B vitamins, zinc and iron. Excessive intakes of vitamin A can also impact soft and hard tissue. Excessive intakes of vitamin A can lead to clefting issues as well, cleft palate, for instance. Vitamin A toxicity can impair oral mucosal epithelium development. And here is a breakdown of oral health and nutritional deficiency in terms of the face. We may see in deficiencies of niacin, B complex, malar pigmentation. Bitemporal wasting may be from protein deficiency. When you see bitemporal wasting, if you look at a population, a starving population, you'll see the hollowed area at the temples, and that is often from protein deficiency. And then pale complexion, inadequate iron, perhaps. Lips, so chylosis, inadequate B complex, niacin, riboflavin. Angular fissuring, again, B complex and iron. Gingiva, inadequate vitamin C, perhaps. And then the tongue. So we said glossitis can be due to deficiency in the B complex, as well as the magenta color, as well as the pale, atrophic, smooth, slick, what we call depapillated looking tongue. So iron and the B complex vitamins. So looking at this photo again, if you see a patient like this, it's often hard to tell what came first, the chicken or the egg. Were they malnourished first, or they had medications that are causing xerostomia, or all of the above, you're definitely going to want to address the xerostomia here. They may actually have a candida infection as well, and then look at the diet. So all of the above. This is a painful condition. This is something that I experienced again while I had C. difficile, and just I had lost over 30 pounds. I weighed less than 95 pounds, and I was severely malnourished. And with colitis, I could not absorb the nutrients very well. So it is a very painful situation. So we want to help our patients be comfortable and get them back to good oral health and nourishment. And again, atrophic glossitis. So this tongue is depapillated, often burning mouth, metallic taste, and it looks like we have some xerostomia to go with it. So children's nutritional status and impact on oral health. Although dental caries, tooth decay is largely preventable, we know it remains the most common chronic disease of children aged 6 to 11. And factors that we said affect food carriogenicity are frequency, food form, sequence, combinations, and composition. We also need to address chronic disabling diseases, jaw joint disease, arthritis, diabetes, osteoporosis affect millions of Americans, compromising oral health function and nutritional status. And the International and Dietetic Nutritional Terminology includes diagnostic terms now related to oral health. Because if you are a dietitian and you've been tasked with providing a patient with a diet to get them back to health, but their oral health is compromised, this diet may not help them. And so oral health has to be addressed along with diet. So proficiency and competency in examining the mouth to identify nutrient deficiencies are highly recommended, and it's thought that the assessment to assess the impact of chronic disease and risk factors on oral health screening should be a component of nutritional assessment. We just sort of demonstrated here it's pretty difficult to pick these two apart and make them separate. I wanted to address a condition called hyperchlorhydria, and this is a condition when the production of hydrochloric acid in the gastric secretions of the stomach are absent or low, often associated with medications now. Your patients may be on medications to suppress hydrochloric acid production. They may have GERD, they may have indigestion, and they're taking, for instance, omeprazole. Those medications are not meant for long-term use, and long-term acid suppression can be a cause for bacterial infections, yeast infections, asthma, allergies, and so forth. An acidic environment is required for the absorption of certain micronutrients. Hydrochloric acid is in the stomach for many reasons. It also sterilizes the food that we eat, and it plays a critical role in the absorption and utilization of protein, iron, folic acid, vitamin B12, vitamin C, calcium, magnesium, zinc, copper, chromium, selenium, manganese, vanadium, molybdenum, and cobalt. And when in decreased levels, hypochlorhydria may lead to nutritional deficiency and disease. Now, although chronic indigestion is often treated as an excess of stomach acid, low acid in the stomach can also have the same symptoms. So it can create a fullness after eating, heartburn, and belching. Hypochlorhydria is also common in middle-aged people. Aside from the discomfort involved, it can compromise the health, and again, may be associated with omeprazole and similar medications. And also patients on long-term proton pump inhibitors, which is what we're talking about here too, have a risk for C. difficile. So it's not just antibiotics. Hypochlorhydria may encourage the growth of the bacterium Helicobacter pylori. And some of these patients that do have a Helicobacter pylori infection may go on to develop ulcers, and that can lead to damage of the stomach and the small intestines. Others can also experience inflammation of the stomach lining known as gastritis. Now, hypochlorhydria, this was a study on children in 2012, and they had H. pylori-related hypochlorhydria that were also found to have low iron levels in their blood. They had iron deficiency anemia because they did not have enough stomach acids to help produce what was needed to create their red blood cells and maintain the red blood cell levels. Xerostomia also can be caused by diet, as we said, and we know that dry mouth can impact the ability to chew, swallow, and digest foods. Enzymes are required in the saliva to be incorporated with the saliva to initiate digestion. Digestion is initiated in the oral cavity. We need saliva to be able to do that. We need healthy innervation and musculature and dentition to initiate digestion as well. So proteins, carbohydrates, and fats are initially digested beginning in the oral cavity. If you're lacking saliva, you may be lacking the ability to initiate digestion. We need saliva to form bolus for swallowing. And many of our patients may develop this condition, and they may be self-treating. They might be using sugary beverages, lemon juice, cough drops. We know it's caused largely by multiple medications, and these patients are at risk for root caries, fractured teeth, poor dentition, frequent candida infection, and it all impacts their nutritional status. So here's a patient. If you saw this patient, would you expect them to be well nourished? No. So when we see this patient, not only do we need to look at this patient and say, oh my gosh, the level infection here is concerning, well concerning. This patient suffered for a long, long time. But also, are we going to ask ourselves, what are we going to do for this patient so that we can help them initiate digestion and become better nourished and a part of society, right? So this is xerostomia's impact. It's a double-edged sword. It impacts the structural and mucosal integrity. They can no longer digest their foods properly. Likewise, impaired digestion and absorption means it's going to further affect structural integrity. Okay. Any questions or comments? So tomorrow night is a course on xerostomia that I'm presenting. So if you want more detail on xerostomia, please be sure to register for that class. It's also available on demand. And again, for those of you that were here for the live presentation, if you joined us a little late, I want to make sure that you have the handout. I'm going to repost that in the chat area. For those of you that are watching the recording from our website, to take the quiz and download the handout, please just scroll below the video to the instruction area, and you will see a line to download the handout as well as access the quiz. All right, everyone, if there aren't any further questions, let's go ahead and we are going to log out. You are going to be redirected now to complete a quiz. You'll have multiple attempts. The quiz will also be emailed to you at 6 o'clock, 6:05, from noreply@clickmeeting.com. That is the same sender as the email confirmation you received to join the live presentation this evening. Okay, it will say thank you for attending. You'll all be sent that email. Again, we're going to send you right now to take the quiz. So I thank you all for being here. Be sure to sign up for our xerostomia course. And question about here, this is a comment, we're not quite done. I think the lecture is more theoretical. Well, Richard, the issue here with vitamins, which I didn't mention, and I should have, so thank you for saying that. Vitamins are not FDA approved. Probiotics are not FDA approved. They are supplements. These companies cannot make claims to cure you or treat your infections or your ailments. Otherwise, they would have to be approved by the FDA. Now, in terms of theoretical, there are some aspects of this presentation that aren't theoretical. Protein, energy, malnutrition, that is in the literature, and we have included that in the citations. In terms of protein deficiencies causing xerostomia, that is in the literature multiple times. In terms of your vitamins and your probiotics, if you are advising your patients to use these, understand that you're advising your patients to use supplements that are not FDA approved. And not one of these companies are FDA approved. Why is that? They don't need to be. They're a multi-billion-dollar industry, and they don't need to get the government involved in their business. As long as they do not make claims, what you will see is they will state in such and such study, it's been shown that taking this probiotic, Lactobacillus rhamnosus GG, has been shown in some studies to reduce the incidence of gastric upset with antibiotics. They aren't saying that their product is doing that. And that's cultural, by the way. So yes, the portion here on vitamins, theoretical. The portion on xerostomia, the portion on not treating older adults effectively and screening them for malnourishment is not theoretical. And we know that patients that are malnourished do not heal as well as patients that do. We know older adults who do not have their oral health needs met, they are going to socially isolate very quickly. All right, everyone, thanks so much for joining us. And we're going to go ahead now and send you off to the quiz. Please reach out if you need any assistance.